homeless person if you didn't know me? No? Oh, cool. It's because I'm a ninja. No, I'm kidding. Homeless person.
Homeless in Toronto. According to Jenkinson, the global homelessness crisis, estimating around 150 million people, or 2% of world's population, lack permanent housing. In Toronto, Canada, a significant concentration of homelessness exists with 8,715 individuals reported as homeless. According to Homeless Hub's 2021 report, 6,605 Canadians sought refuge in shelters, while 2,742 sought emergency shelter. Among them, 795 received temporary shelter, leaving 742 without any shelter access. These findings emphasize the pressing need for effective strategies to address homelessness in Toronto and beyond.
Homelessness results from mixed challenges, including mental illness, worsening physical health, addiction, divorce, family disintegration, and maltreatment of any form, institutional or social barriers, lack of affordable housing, and cognitive issues, as well as racism, are all potential contributing elements to this problem. It creates barriers of stable housing and perpetuates cycle of poverty and marginalization, contributing to the prevalence of homeless in the society. There are critical reasons for homelessness in Toronto. Number one, the health of the real market. The cost of renting an apartment has skyrocketed in the recent decades. As you can see in the graph, it has shown a consistent upward trend from 1996 to 2008. Number two, housing expenses have risen due to epidemic, which has increased unemployment and restricted labor opportunities. And number three, inflation rate or economic factors. The rising cost of all necessities, including food and housing, influenced by the factors such as changes in demand and supply dynamic. It becomes more difficult for low-income individuals to afford rent or mortgage payment.
Hi everyone, my name is Steffi Victor Kadavel Parmal Victor. My student ID is 141278234. I'm here to discuss the topic Evaluation of Homelessness in Toronto. Based on a study conducted by Street Need Assessment on April 21, 2021, it is estimated that there are 7,347 homeless identified in Toronto. They include those who sleep in outdoors, camping facilities, base emergency units, transitional shelters managed by City Council, 24-hour respite units, 24-hour women drop-ins, COVID-19 response and isolation units, violence against women shelters, health and treatment centers, prison facilities run by province. These are the key findings from the evaluation. Demographic patterns. Data from the Canadian Observatory on Homelessness and the City of Toronto reports increasing number of homeless people in Toronto, which is estimated as 8,000 on any given night, despite of initiatives being taken to reduce the number. Housing and employment. Overpriced rental units, rising prices of housing, unemployment, and low wages are other contributing factors of homelessness. Utilization of housing facility. Homeless shelters are frequently filled to capacity and also has in high occupancy rates. There will be also overcrowding and excessive demand of housing. Dependence on emergency shelters as a main response of homelessness underscores the need for more long-term housing solutions. The realities faced by homeless community. The untreated mental health conditions like depression, anxiety, post-traumatic stress disorder, and substance abuse. There are also limited access to job opportunities, social welfare services, and medical treatments feeds this unending cycle of homelessness and poverty.
My name is Arena March de la Serna, student number 134207216. To address the increasing number of homeless people in Toronto, we needed to develop effective community interventions, and a comprehensive assessment strategy would be necessary. And here's a structured approach for conducting such an assessment. First assessment strategy is the needs assessment survey. This strategy is crucial because it directly captures the perspectives, experiences, and needs of homeless individuals, service providers, and stakeholders. Understanding the specific challenges faced by the homeless population in Toronto is essential for developing effective and sustainable solutions. Second assessment strategy is stakeholder interviews. By engaging with these key stakeholders, it provides us valuable insights into systemic issues, policy barriers, funding constraints, and collaboration opportunities. Stakeholders such as government officials, NGOs, and community leaders possess expertise and resources that can influence policy decisions and drive community development efforts. Their perspectives and recommendation can help shape and design the implementation of intervention programs. Thirdly would be the resource inventory and gap analysis. This helps identify areas of improvement and resource allocation. This ensures that interventions are targeted toward addressing specific gaps in housing, healthcare, employment support, and social services. And lastly, it facilitates strategic planning for optimizing resource utilization and enhancing service delivery effectiveness. And finally, we have the community consultation and participatory planning. Involving the community through consultation, participatory workshops, and collaborative planning fosters ownership, buy-in, and sustainability of interventions. Participatory approaches promote inclusivity, transparency, and empowerment, leading to more responsive and culturally competent solutions. These four assessment strategies are essential because they combine data-driven analysis with community engagement, stakeholder collaboration, and targeted resource allocation, thereby enhancing the effectiveness and impact of interventions to address the homelessness in Toronto.
In resolving the issue, we need to understand who are the stakeholders. In this, we have the government, the non-profit organization, the people of Toronto, healthcare organization, and the homeless who are the benefactor. Now, looking at the stakeholders, we can understand that they have strengths that will be able to assist in resolving the issue. In 2022-2023, $48.6 million were provided by the government in support and funding for the homelessness. Next, non-profit organization and people of Toronto provided various organizations that are available to address the issue, such as the Street to Homes, that they offer diverse range of services including street outreach, mental health support, and housing assistance. Healthcare organization also assisted with providing 11 emergency shelter locations, which is city-run, 57 emergency shelter location agency operated, and 7 24-hour respite site agency operated. In resolving the issue, we need to do capacity building. On the individual level, we need to do training and skills enhancement for our frontliners on handling homeless people who have worsening physical problems, drug addictions, and food scarcity. On the organizational level, we need to enhance partnership collaboration with various stakeholders to simplify the process and eliminate inefficiency in services, minimize repetition, and optimize resources. We need also to improve infrastructure such as shelters and logistics. On community level, we need to create more public awareness campaigns and community engagement and partnership. We need to do also government agency collaborations. On expected outcome, we have short-term, mid-term, and long-term. On short-term, raise awareness within the community about the persistent homelessness crisis in Toronto. Role awareness of public health workforce in addressing the issue. On mid-term, identify various communities where homelessness are high. Implement strategies to address needs on individual levels. Treat and address those with specific issues such as drug abuse or mental health. Engage community to be more proactive and involved in resolving this issue. And we need to empower homeless individuals. On long term, homeless individuals are aware of various resources they can use to address their various issues and sustainable solutions such as housing that will result to improve quality of life.